Hello everyone, my name is Ellie Dinkmeyer. I am one of the athletic trainers and sports medicine teacher at A&M Consolidated High School. This video is covering the femur and pelvis. We're learning about the hip joint in my class right now, and so hopefully this is helpful for you on your anatomy practical. So let's get started. Number one, this is an anterior view of the right hip. Now, one thing about this model is that it is interestingly tilted. This isn't really accurate. It should be more like this. Okay, so I'm gonna try to change that angle up whenever it is necessary, but just so you know, this is not really anatomically correct. It'd be more like this in a real hip. So what we're looking at here is an anterior view of the right hip. This is the femur bone, which we've talked about at length in class, and this is the pelvic bone. Remember that the pelvic bone is made up of 3 bones that they're fused together after puberty, and they're made up of number 1, the ilium. It's this big bone here that kind of makes this dish shape. Bone number 2 is the pubic bone, which is at the anterior portion right here. That's the pubic bone. And then on the posterior side, you will see the ischial bone, the ischium. So on the posterior view, you will see the ischium here, okay? So back to the anterior view. That is the bones that we're working with right now, the 3 parts of the pelvic bone and the femur. So on the femur, we've got some bony prominences that we need to be aware of. So bony prominence number 1 is this big, large protuberance here, which is called the greater trochanter. Okay, that's your big, if you feel your side of your hip, you're gonna feel this big notch. That is the greater trochanter. You can see a little bit from the anterior view, this guy right here, but you'll see it better from the posterior view. This is the lesser trochanter. And between these 2 structures, the greater trochanter and the lesser trochanter, we have the intertrochanteric line. If we were to rip away the ligaments of this model, you would see here, right in this area, would be the neck of the femur, and then you'd be able to see the femoral head as well. Remember, the femoral head is the ball of the ball and socket joint, and then it sits nicely in the cup of the pelvis, which is referred to as the acetabulum. So the ball and socket joint of the hip is the head of the femur and the acetabulum of the pelvis, creating that ball and socket joint. Moving on to the bony prominences of the pelvis, we have here, again, it's supposed to be tilted like this. If you were looking at the ilium, the big cup shape here is the iliac fossa. The iliac fossa. Then if you look here, the point of your hip, that is your ASIS, your anterior superior iliac spine. Then you go down a little bit and there's your AIIS, anterior inferior iliac spine. So ASIS, AIIS. Remember, those directional terms let you know which is which, superior versus inferior. And again, iliac fossa, okay? Next thing on the ilium is the iliac crest. If you put your hands on your hips, right where they kind of lay is the iliac crest, kind of like a pizza crust that goes all the way around the ilium, okay? Then if we're here, you can also see this roughened area right here is where the sacrum articulates with the pelvis, which creates the SI joint, the sacroiliac joint, okay? Then if we look here at the pubic bone, you have this right here, which is the pubic tubercle. And if we had the second model of the left, where they articulate in that little piece of cartilage right there, that would be the pubic symphysis, okay? If we spin this model around to the posterior view, you're gonna see some other structures. Again, to orient ourselves, we have the iliac crest. It would typically look like this if this model was anatomically correct. On the ischium, you're gonna see the ischial tuberosity. That's kind of your butt bone or your sit bone where you sit down. This is your ischial tuberosity. That's what you're sitting on when you sit down in a chair. Then you're gonna have here your your PSIS, posterior superior iliac spine. Then down here a little bit, you're gonna have the PIIS, posterior inferior iliac spine. So on the anterior side, you're gonna have your ASIS and AIIS. On the posterior side, you'll have their PSIS and PIIS, okay? Then this big notch right here, this is where the sciatic nerve goes through. This is the greater sciatic notch, lesser sciatic notch, and ischial spine. Okay, if you look here, you can see those notches a little bit more clearly. Greater sciatic notch, lesser sciatic notch. Okay, back to the traditional posterior view. Again, to orient ourselves, you have the greater trochanter, intertrochanteric line, lesser trochanter. We've just looked at the ischial tuberosity. Again, remember when we talked about the hamstrings, all three of the hamstring muscles are going to originate on the ischial tuberosity. So that'll be right there. Okay, what else have we not covered yet? I think that is about it for the bony prominences that you're going to learn in my class. So now let's go on to ligaments. The ligaments that we are going to focus on in my class, there's the big three that kind of spiral around from the pelvic bone to the femur. Number one, on the anterior side, you will see this ligament that kind of looks like a Y. This is the longest and strongest ligament in the body, and it's called the iliofemoral ligament. You can tell that because it goes from the ilium to the femur, that big Y ligament, iliofemoral ligament. Okay, the next ligament we're going to talk about that you can see on the anterior side. This model shows an interesting view of it in different anatomical models and different anatomical pictures you'll find on Google. This ligament is shown in a couple of different ways, but on this particular model, it's the only ligament that even touches the pubis. So the pubic bone is here. So the only ligament that even touches that is this guy here that goes underneath and kind of wraps around. If you look at it from an inferior view, you can see him here. That is the pubofemoral ligament. So iliofemoral ligament, pubofemoral ligament. On the posterior side, you can see our third and last ligament that we're going to worry about. This is the ischiofemoral ligament, going from the ischium to the femur, the ischiofemoral ligament here. So those three ligaments really suck in that ball and socket joint to create some stability and take some pressure off of those bones in ambulating. Okay, so those are the three ligaments. One ligament that you are not going to be able to see on this model is the ligamentum teres, which connects the head of the femur to the acetabulum of the pelvis. And remember, that's the one that has a little bit of blood supply to the femoral head through the obturator nerve, which you will not be able to see on this model because it is locked in. Another thing you can't see on this model is the acetabular labrum. Remember, in the shoulder, we talked about the glenoid labrum. Well, the hip has one too. It's called the acetabular labrum, and it creates that cartilaginous little cup to, again, create a little bit more stability in this hip joint. These ligaments are super, super strong. We also are going to learn about all of the muscles that attach here. So this is a very, very stable joint, unlike the shoulder. I hope this is helpful. Let me know if you have any questions or concerns. Thanks.